scalable innovations. We work collaboratively with proven on-the-ground NGOs and other partners, such as those on the panel today. Our projects cover 6 areas: water, health, education, energy, livelihood, and sustainability. A brief introduction to WHEEL's 30 plus initiatives was presented prior to start and will also be run at the close. As you know, WHEELS is a volunteer organization and depend on generosity of our donors who share our vision of impacting 20% of India's rural and underserved population by 2030. You can also get additional information on our website in the initiative section. We look forward to your generous support and contributions with time, treasure, and talent. A quick disclaimer: all the views expressed on the webinar today are strictly reflect the opinions of the speakers and not necessarily of WHEELS or its board. Some housekeeping rules: all attendees are on mute throughout the webinar. You may ask questions to the panelists using the Q&A box or typing your message in the chat box. At the conclusion, we will be taking many of the questions for answers by our speakers. We also will have a recording available on our website and on YouTube, and audience will be able to interact with with our speakers at the conclusion after the main program is over. So with that, let me introduce our moderator today, Dr. Raj Shah. Dr. Raj Shah is the chairman of our WHEELS Health Council and a practicing cardiologist, philanthropist, and entrepreneur. Dr. Raj received his medical degree from Baroda Medical College, followed by MBA programs at University of South Florida and Wharton School. He is also an associate professor of clinical medicine at the Temple and Drexel Universities. Dr. Raj is a pioneer in the field of telemedicine with creation of SmartCare Doc telemedicine system and leading the first deployment of a telemedicine solution in a retail setting way back in Walmart in 2012. He also established a teleretinopathy screening program at Temple Health University Health System in 2016 and teaches healthcare finance class at Rutgers University. With that, it is my pleasure to welcome Dr. Raj. Dr. Raj, go ahead, please.
Thank you, Ratanji. Thank you for your kind introduction. Welcome to today's webinar by WHEELS Health Council, which has more than 80 members from USA and India, covering many specialties and expertise in medicine, technology, legal, and social entrepreneurship. Today's event is part of our WHEELS Council forums, where thought leaders like our speakers today share their inspiring perspectives on a variety of social impact topics. Today's topic focuses on WHEELS health domain, covering innovative initiatives in 4 key areas: delivery of affordable quality care through telemedicine, newborn and mother's health, mental health, and menstrual health. You will learn how WHEEL is working with technocrats, healthcare providers, social impact leaders, and various foundations for building innovative public-private partnership to drive impact at a scale. With our portfolio of 7 health solutions, we are working in nearly a dozen states for impacting millions of lives. Along with my webinar co-chair, Dr. Bindu Kumar Kansupada, I'm delighted to be joined by 7 guest speakers whom I will be introducing as we go along. Each speaker will be sharing their perspectives for 5 minutes, and then at the end, they will be participating in answering your questions. A word about our webinar. More than 2/3 of India's population is rural, and they lack presence of qualified doctors and healthcare facilities. There is nothing. Will's rural telemedicine solution leverages power of technology to make quality medical care accessible and affordable to all without having them to travel a long distance. It combines smart software for triage with network-connected devices for diagnostic data, and they are installed at remote rural telemedicine sites where patients can receive timely care. We initially started with 306 sites during COVID, and now our goal is to scale to 10,000 or even more sites through innovative partnership for complementing resources and capabilities. Our next two speakers highlight such partnership. The first one with Samhita Collective Good Foundation, CGF, we launched 25 telemedicine sites at the community service centers, so-called CSCs, and we hope to take our solution eventually to all 600,000 CSCs being developed under government program in every village of India. And the second partnership is our integration with Government of India's revolutionary and pervasive e-Sanjeevani program, which gives us nationwide access to doctors in public health centers. Without further ado, let me introduce our first guest, our Health Council member, and my dear friend, Priya Nayak. She's the founder and CEO of Samhita Social Ventures. Priya is the distinguished alumnus of Bombay University, Yale, and MIT USA. Priya's belief in collaborative action and the power of responsible corporate citizenship is reflected in the multiple partnerships that Samhita has structured amongst corporations, Indian and international foundations, government agencies, social organizations, and academic institutions to maximize social impact. A frontrunner in building the narrative around corporate responsibility, Samhita is actively moving the needle from corporate's checkbook philanthropy to a purpose-led, sustainable commitments. I invite Priyaji to share how Samhita's initiative is unlocking resources, enabling 1 million entrepreneurs and several million jobs, and also how CSCs will be a great channel for rapid scaling of Will's Rural Telemedicine Initiative. Priyaji, please take it.
Yeah, thank you, Dr. Shah. It's really a pleasure to be here with all of you. I think Dr. Shah talked about, the state of rural healthcare. JBJ, if you are able to just bring up my slides. So if you think about the average rural citizen, right, they face many, many, many challenges. Everything from, JBJ, if you can move to the next slide. Everything from limited access to digital and financial literacy to the fact that hundreds of governance schemes have now been announced, but the reality is that the rural population is not really either accessing it or has the means to access it. To top that up, access to credit is fairly limited. Access to markets is, very, very limited again. And so the way we think about the work that we do is how do we really bring all of this together? JVG, if you can just skip to the next two slides, please. The next one. Thank you. So the way we imagine the world is if you keep the rural woman or the rural man at the center of many interventions coming together. And today, while I will talk about the CSCs, there are many other partners that we're bringing to the fore, including Wheels Global. So the way we set up the construct is we keep the citizen at the center. We ensure that we work closely with multiple government departments to unlock a series of government schemes and subsidies. We also work with many financial partners to ensure that the rural communities have access to credit, savings, investments, and insurance so that the They go from being able to just be recipients of healthcare to actually being customers of healthcare. This is something that they should be able to afford. Today, we work with Microsoft, LinkedIn, and a large number of providers to ensure that, again, rural communities have access to skills and jobs and career progression. We have a partnership with ONDC, which is the Open Network for Digital Commerce, to ensure that 1 million women actually have the ability to transact on ONDC and therefore open up markets. ONDC is also now ensuring that access to healthcare services will be available soon. We work with ISB to unlock entrepreneurial opportunities. And then really delighted about the partnership with Wheels Global to ensure that healthcare services are delivered to rural communities seamlessly. JVG, if you can go back one slide. We recently partnered with USAID to ensure that particularly women that are between the ages of 19 to 29 and really, the future of our country have access to everything. They need to have the right information. As a 19-year-old woman, my needs from a healthcare perspective look very different compared to when I'm 25 or when I'm 35. And therefore, to ensure that every woman has contextual information at the right time at her fingertips is important. We combine that with ensuring that she also has access to products and services. And so the telemedicine work is critical because women have to then go from knowing what they need to then being able to access what they need. Women are also encouraged to open up health savings accounts, and all of the livelihood initiatives ensure that she can now access affordable care. JVG, if you can move 2 slides. So the CSC, another slide, the CSC is a core partner in this effort. There are 580,000 common service centers that are run by the Ministry of Information and Technology. The CSCs themselves are run by entrepreneurs, which are called VLAs. And the reason we're so excited about the partnership with them is because they really are spread across the length and breadth of the country. And what the village level entrepreneur at the center of the CSC does is they unlock a series of healthcare and livelihood support to rural communities. So when Dr. Shah was talking about the telemedicine solution, what that really means is that the CSC is not just able to train rural communities in what is needed from a healthcare perspective, but through digital means, they are now able to connect them to not just the telemedicine providers, but also a large ecosystem of product and service providers. Menstrual health and hygiene is really critical, and I know that the other speakers will also talk about that. In addition to access to healthcare, the CSC also unlocks government schemes and services, skilling, market linkages, and financial digital inclusion. And so what we're really seeing here is an assisted model that is spread across the length and breadth of the country to ensure that any woman or man, right, across India now has the ability to access everything from healthcare to livelihood to government schemes and services almost seamlessly. I just want to end by saying, JVG, if you can move one slide. As we work with the next one, but as we work with women across, CSCs, etc., what we're seeing really are stories of empowerment, right? Women who otherwise were just recipients of, government schemes and services are now becoming entrepreneurs. They know exactly which woman or which man or which child needs what because they're so familiar with the community. They have the ability to take the training and the support that we give and provide targeted healthcare interventions to each and every one consistently across, the many, many people we've now worked with. We're really seeing this transformation from rural communities being just recipients of free services to becoming fee-paying customers who value and understand why healthcare is so critical to also being champions and change agents. We've been really delighted with the partnership with Wheels because while we bring Samaj Sarkar and Bazaar together, I think the entire IIT ecosystem and their ability to innovate very rapidly enables us to now bring in affordable and, sort of really tech-enabled, the latest products and services that the IIT ecosystem is now creating into rural communities in a way that there's not just a product and person match, but these are truly affordable and sustainable products and services, right, that we're now able to deliver to millions of people across the country. Thank you very much. Really delighted to be here. If there are any questions, I'm happy to take them later.
Priyaji, thank you so much for in such a short time telling us about all the activities of the Samhita Foundation and our partnership, in particularly bringing our telemedicine solution and other solution through CSC, which you have championed to work with and expanding that network. Thank you. It's my pleasure now to introduce our next speaker, my good friend and Health Council member, Dr. Sanjay Sood. Dr. Sood is a prominent figure in global health and a leading digital health innovator driving telehealth system worldwide. With extensive experience in large-scale digital health implementation across various regions, he has significantly contributed to advancing digital health initiatives. Dr. Sood is currently spearheading eSanjeevani. eSanjeevani is India's national telemedicine service, which is the largest telemedicine platform in the world and has already served in less than 5 years around 300 million patients nationwide. His leadership in this project earned the Digital India Award 2020 from Honorable President of India. We are fortunate to have his guidance and help in the approval to integrate eSanjeevani program in Will's telemedicine software platform and offering. Sanjay ji, thank you very much, sir. Thank you. Dr. Sood, please share how you tackle building a gargantuan task of national scale telemedicine platform to serve nearly 800 million people in rural and remote parts of India, and how Wills can best work with you to have this great capacity. Dr. Sanjay Sood.
Thank you. Thank you very much, sir. At the outset, I congratulate Will's Health Council for organizing this webinar and thank organizers, including Dr. Raj Shah, for inviting me. At CDAC, we have used our long-standing expertise in the field to initiate this promising project for the Ministry of Health and Family Welfare, Government of India. And we started with a very clear vision and that in a phased manner. The platform has been evolving since 2002, or rather the technology has been evolving since 2002 and has been developed in close collaborations with doctors and practitioners, simply ensuring that it met practical needs of healthcare providers. Our team that is uniquely experienced in implementation successfully navigated the complexities of rolling out such a large-scale initiative. Despite the limited adoption of telemedicine in the country between 2002 and 2015, when we had facilitated around 75,000 consultations, which now really looks an ordinary accomplishment, but we do know 75,000 consultations in that period was a huge accomplishment. And now, especially when eSanjeevani is facilitating around 500,000 consultations every day, and I am really happy to see that eSanjeevani is now amongst countries' leading digital public infrastructure. As regards the future, we are committed to continuous improvement and expansion as well. And our goal is to scale up to serve over 1 million patients every day. We are also exploring ways to integrate with other health initiatives like Dr. Raj Shah mentioned, and we are expanding our range of services to address various health needs. And the other Indian governments or Indian health administrations initiatives like Telemanas, etc., have also been integrated with eSanjeevani. And in times to come, in very near future, besides leveraging AI and ML, we are looking forward to seeing eSanjeevani serve beyond Indian borders and extending its impact globally. As far as the role that Wheels Health Council or Wheels Global Foundation can play for eSanjeevani or with eSanjeevani, it is that that we are working towards quite a pivotal role in this journey, wherein Wheels Health Council is already accepted or agreed to provide support and resources that extend beyond eSanjeevani's current scope. We have been collaborating with Wheels Health Council's team of late, and the key aspects where we are trying to derive synergies include enhancing doctors' availability on eSanjeevani platform. Specifically, during peak hours, we realized that the patients outnumber the doctors available. So Wheels can certainly help and provide an additional battery of doctors and specialists during peak hours to ensure patients receive timely services. And not only peak hours, but also during odd hours at times, various state administrations are providing services around the clock, but there are certain states or majority of the states where these services are not being provided. Again, Wheels Health Council can chip in there as well by making or by taking advantage of the different time zone that these clinicians, if they can extend their services to the patients in India during odd hours. And then we are rather in discussions with Dr. Raj Shah to help our team to design algorithms and also improve the platform by getting assisted in designing these algorithms or leveraging the domain expertise, because we are working on e-prescription audits, which will again be based on AI and ML techniques, wherein a lot of domain expertise is required. And this is where Wheels Health Council can chip in. And besides this, we keep on continuously coming up with new features. And before we put them to production, we really need a very, I would say, a very detailed feedback on those features from the practitioners specifically. So we can request Wheels Health Council to help us in providing these forward-looking practitioners who can assess the features and help us to polish them or realign them or improvise or enhance them to ensure that the practitioners on ground in India are empowered with these features. And besides this, I'm sure Wheels Global Foundation in totality can also help to increase awareness of eSanjeevani across the country. And we believe that Wheels Global Foundation's involvement and Wheels Health Council's involvement can significantly enhance our efforts, bring additional expertise, resources, and strategic support to our initiatives. And together we can drive significant positive change in the health landscape for the underserved. Thank you so much, sir.
Thank you very much, Sanjay ji. Thank you for bringing this to our audience, the amazing work being done by government's program, and Wheels is happy to have your help and guidance to take this to the end user at the door, at the footstep of villagers, where we provide the infrastructure for them to enjoy and to use this amazing service of our government. Thank you again. Now, let's talk about next segment of our webinar, newborn and infant nutrition. According to the latest National Family Health Survey, 36% of children in India are stunted, 32% are underweight, and 21% are wasted and have significantly higher infant mortality. After our Health Council leader, Dr. Rupal Dalal's pioneering research revealed that real root cause was lack of proper breastfeeding technique. Dr. Rupal and Professor Madgalia at IIT Bombay developed the spoken tutorial to teach breastfeeding technique. The program showed great results in 7 districts in Maharashtra, Gujarat, and Chhattisgarh. This newborn nutrition health program is now our flagship initiative to tackle these pervasive challenges. Wheels has launched statewide deployment in Madhya Pradesh with a unique public-private partnership for scaling. The strategic funding comes from Rural India Supporting Trust, RIST. Our next three guests would be sharing key aspects of this initiative, which alone has potential to impact more than 200 million mothers and babies. Our first guest is Ms. Priyanka Das. She's an IAS officer of 2009 batch, presently posted as the Mission Director of National Health Mission in Madhya Pradesh. She has completed her postgraduate and master in philosophy from Center for Political Science at Jawaharlal Nehru University in Delhi. She cleared her civil service exam in 2008 in her first attempt and secured national rank of 47. Ms. Das has handled several challenging assignments as Municipal Commissioner of Bhopal and Commissioner of Mandi, and as a district magistrate of 4 districts, namely Tikamgarh, Hoshangabad, Ashoknagar, and Morana. Bhopal was declared as the second cleanest city in the country under her leadership in 2018. Today, she's unable to come online as she's on assignment, so we'll listen to her recorded video talk. Ms. Das's video, please.
Hello everybody, this is Priyanka Das, Mission Director, National Health Mission, Madhya Pradesh. I am delighted to share that in Madhya Pradesh we have taken up a very innovative training program for our frontline workers with the support of Wheels Global Foundation. A little bit of background regarding the necessity. Madhya Pradesh as a state is very diverse, both in terms of demography and geography. It is culturally diverse as well. So there are a lot of practices which kind of impede the right kind of nutrition that a newborn is required from its mother. Looking into the statistics which comes from the National Family Health Survey, that also indicates that a child does not require, is not able to get the right kind of nutrition from the mother. As a matter of policy, it is mandated that the baby be initiated to breastfeeding within the first hour of its birth, and there should be exclusive breastfeeding for 6 months. However, the message needs to be disseminated to the mothers, to the frontline workers, the ASHA, Anganwadi workers, the community health officers, so that this practice is actually adopted by all the mothers. Another hindrance which we found was not just the initiation part of it, but also many first-time mothers have difficulty in terms of expression of milk and then enabling the baby to suckle. Though it might sound that it's very easy, it is intuitive, mothers naturally are able to feed, babies are naturally able to suckle. The fact of the matter lies that is not the case. A lot of research has gone into it, and there are proper breastfeeding techniques that need to be taught to the mother. And here I would like to appreciate the efforts and the research of Dr. Rupal Dalal, who is one of the leading resource persons for these for this training program, and banking on her content and the content of the Government of India, Ministry of Health. It is jointly disseminated through a very innovative platform developed by IIT Bombay, and there are spoken tutorials for the frontline workers and the mothers, through which we are training our first group of master trainers in Madhya Pradesh. In Madhya Pradesh, we are taking it up across 7 districts. We have chosen the districts which are are all a challenge in themselves. They are spread apart, and we are training these the resources of these districts with the aim that we are able to scale up the project in future in the state. I hope that the efforts, the collaborative efforts of all the doctors, the teams, the field workers of Madhya Pradesh, along with the RIST team, the Wheels Global Foundation team, the IIT Mumbai team, leads to fruition and success for the state, and we are able to improve the child feeding parameters and the overall health parameters of the child and neonates in our state. Thank you.
Thank you, Ms. Das, for your help, your guidance, and without you, our program in Madhya Pradesh would not have been possible. So we thank you. It is my pleasure to introduce my dear friend and Health Council member, Dr. Rupal Dalal. She's an experienced pediatrician with a demonstrated history of successfully working in the hospital, in private practice, and nonprofit organizations. She's skilled in first 1,000 days health and nutrition of the child, lactation education, and pediatric medicine in urgent care setting. She's passionate community and social service professional with advanced degrees in pediatric nutrition and urgent care. Dr. Rupal, please briefly share with our audience the results of your research and finding of link between breastfeeding technique and malnutrition, and also your all-out relentless pursuit to tackle this correctable health problem in partnership with IIT Bombay, Wills Global, and government agencies. Rupal, take it from here.
Yeah. Thank you, Dr. Shah. Thank you, everybody, for giving me this platform to talk. I'll just share my presentation. Okay. Can you see my presentation? Hello?
JVG, can you enable screen sharing?
Yeah,
Yeah,
I can do it. I can do it.
Yeah, go ahead,
So-
Dr.
Dr. Rupal, I think your
Pneumonia
screen froze.
emergency was malnutrition. Okay, no. Here. Can you see this?
No, not yet.
Not yet.
It again.
So it's
Okay.
taking time actually. So,
Okay, no, JVG, you can share my screen.
okay, so I will share you some slides so you can just.
Great.
Okay, go ahead. Next, please. So when I moved back, I realized that the problem was malnutrition because almost 50% children who die of diarrhea pneumonia, they are malnourished. So this was the, this is the latest data. As you can see, pretty much all red. And all these children are stunted. Stunted means they are less than -2 standard deviation for height. Next. And this is what I thought that, as a pediatrician, I think this is an emergency because it's not only increasing mortality in children, but it's also decreasing the IQ. So our future generation is at stake because if you have 36% children who are stunted, so they are basically, they will not be able to give it back to the economy of our country. And here, you can see that our goal is basically to have a healthy baby born. So here, this particular A&M was trained by us in Nashik. So now over there, we are seeing babies who are 4 kg, 4. These are literally as what we see in US, 10-pound baby. Here, there's another picture of a newborn baby, 3-month-old. Here, what A&M has done is to train the mother how to breastfeed. So that's what we work on. And here you can see 9-month-old baby who is basically standing with the flag. This is 9-month-old child, Indian baby, beautiful. So this is what our work is on. Next. And here all tribal babies, we predominantly work in tribal areas. In fact, right now I'm sitting in a Madhya Pradesh Shepur district, which is one of the very aspirational district and very, very difficult, challenging district to work in. We're here for 12 days for training. Next. Our focus is very much on proper technique of breastfeeding. We have improvised one technique, cross-cradle hold. We also focus on weight gain, which is equal to milk transfer. Also focuses on complementary feeding, because after 6 months, the children, they don't do well at all. Only 11% children in India are getting proper food from 6 months onwards. So we also focus on that in our training. We teach healthcare workers WHO growth charts and target weight gain. They have a lot of perception in the field, so we kind of bust those myths. And also, as Priyanka ma'am mentioned about breast crawl, so as soon as baby is born, we teach healthcare workers how to initiate breast crawl in the mothers. Next one. Thanks to Professor Kannan, that now we have almost 105 tutorials on health. And through this health spoken tutorial, what we do is we pass on this message to all the healthcare workers, and we select best people who have performed well in our exams. And through health spoken tutorial, again, this are again translated into 15 constitutional languages of India. They are also being translated into some tribal languages. Next. These are all the topics, various topics on maternal nutrition, breastfeeding videos, complementary feeding, nutrition. Go ahead, continue, just go ahead. Yeah, and these are all the different topics that we discuss. Now, there are 250 recipes which are vegetarian recipes and 250 recipes which are non-veg. But these are all low carbohydrate recipes, because we want to make sure that we make children tall and not fat, so that we are very, very focused on prevention of NCDs. Next. Here, in one of the aspirational district of Madhya Pradesh, all these doctors and nurses are watching our tutorial, and they will go through exams, which they are going through some of this online exams. And one platform that we have, QDual application, it is the lifeline of our projects. Next. Next slide, please. Here is our life cycle approach. Our goal is that children should be tall and healthy and should not be fat and stout. Here, after we train them in face-to-face training, we train about 250 healthcare workers. And then once they become proficient by adopting 10 mother-baby diet, because our goal is just not kind of showing videos and let them loose. What we want to do is they have to show that content knowledge in application-based knowledge. So they basically adopt 10 mother-baby diet in different phase groups, like, for example, ANC mothers, newborn babies, and complementary feeding. And then they have to show results in those 10 mother-baby diets. So that's how our pedagogy is. So here, once they are proficient, then they start training other healthcare workers also. Next. Next slide, please. Okay, here the healthcare workers are learning how to calculate protein. So that's what the board was, that because it's important for them to know that how much protein is required. In fact, I bet that even doctors don't know how to calculate proteins. And here are these AAAs, Anganwadi Asha workers, calculating protein and carbohydrate. And I'm so really proud of them. And this is basically 250 people, 7,000 people, and how for each district. So this is the pedagogy. I won't go too much in detail. Next. One slide, and here they all received IC kit. So IC kit has all this breast model, doll, IC material, which is very important in the field. Next. We have also published our results in MCN journal, which is international journal. And we found that mothers who were taught this proper technique of breastfeeding had 3 times less malnutrition at 3 months of age. Here, what we do is once they come for face-to-face training, we handhold them for next 6 months while they are adopting babies. And through WhatsApp, we teach them how to latch the baby, whether it is correct or not. So this is a very crucial part of our training. Next. Just last couple of slides and I'm done. So here, Priyanka ma'am already mentioned. So this is 7 districts. So right now we started with face-to-face training in the first district of Shevpur. Next.
That's it.
Thank you so much. So yeah, thank you so much. Yeah.
Thank you, Rupal. Thank you for really such a great program that you have created and you're implementing. And by the way, Rupal is calling from the field. She's so passionate. She's at the ground level. She's in those villages and where there is no great bandwidth. In spite of that, Rupal, you did phenomenal job. Thank you so much. And by the way, to the audience, please submit your questions. We'll be coming at the end to answer them. And we'll be delighted to have your feedback. Now, it's my pleasure to introduce our next speaker. And our next speaker is Paul Glick, who is Executive Director of Rural India Supporting Trust called RIST since 2014. Paul's leadership has assisted in the growth of RIST as a respected grant-giving entity focused on poverty alleviation in India. I think in last 5 years, they have given grants of more than $120 million. He's a career international development professional with more than 20 years of extensive experience in all aspects of program development, implementation, and management, concentrating on community development issues and social service provision with an aim of improving quality of life, stakeholders' engagement and mobilization, full cycle grant management from start to completion, workforce development, capacity building, and conflict management. Paul, we are grateful for giving Wills a generous $400,000 grant for MP State project. Thank you, sir, and thank you to RIST Foundation. Paul, please share with us the key role RIST as a funding provider plays in solving complex challenges at scale in health, education, and other domains. Also share your views on the opportunities between USA and India partnerships, especially through leveraging technology and innovation, and how current Wills project fits into those expectations. Thank you, Paul. Take it.
Hello, everyone. Thank you very much, Dr. Shah, for that nice introduction and for the opportunity to speak to everybody. So I did want to just first give it might be that many of the audience don't really know who we are. So very briefly, RIST, or the Rural India Supporting Trust, is a family philanthropic foundation. We're a grant giver. So we work with local partners in India on through a variety of sectors, which I'll briefly go over. And we just try to assist through our grants and support to elevate some of the problems that we see across India and many other countries. So first and foremost, we are most concerned with healthcare in India. And our focus is an attempt to create really a holistic approach to healthcare and wellness in general. So in healthcare, we do focus on the systems level of things and try to ensure that services that are provided are of high quality, and also that they reach people all over the country, whether you live in an urban area or a rural area, at an affordable price. This includes mental health and wellness services as well. So in many of our healthcare projects, we do try to integrate mental health services also. Within that, we do fund some educational programming as well that also link in health through health and nutrition programs and STEM. Next slide, please. So another important thing that we fund is related to mental health, but we have a program that focuses on deinstitutionalization. And within that, we really try to reunify people who are in institutions with their families. We work on community homes where people from institutions can live an inclusive life in communities in their own homes with the services that they need. And we also try to work on emergency services that might be needed because a lot of times people who are homeless end up in institutions. Next slide. Of course, now within health, you can't ignore the environment. So we have recently started to focus on programming where we can deal with environmental issues such as conservation, preservation, and biodiversity. And most importantly, we're really focusing on things that address air and water pollution. Next slide, please. So, as Dr. Shah said, I've been asked to kind of give a more of a broad view of things and how philanthropy can fit into all of this. So I've done my best to try to come up with some points of where risks and other philanthropies can be of service to not only the government of India, but to the many grassroots organizations that work there. And I do want to say that I worked for many, many years on the nonprofit side of things. So I understand that it is really a privilege to be able to work on the philanthropy side and be able to assist in the way that I'll describe. So we're a gap filler. We are not the answer. We're not necessarily the ones on the grounds actually implementing these services. But as I said, through working with the government and grassroots organizations, we can assist to keep services consistent and or provide a starting point with the aim later on of the government taking over a service. We also can be innovative. We have, again, the privilege of being able to take risks, sometimes where others can't. A lot of times, a nonprofit organization can't necessarily be all that creative unless they have a funder that's willing to work with them on an innovative type of approach, like we've done with Wheels Global. Research is also an important thing. We like to look into complex issues to ensure that the programs that we fund are effective, and there are always proposed solutions to the many issues that I just went over. Something happened to my presentation.
JB,
Anyway,
can you share
I'll
the slide?
continue. It's fine. We work on advocacy as well. So advocating for progress that is backed by facts. And it's not our role to formulate policy, but we provide information to policymakers when asked. Duplicating successes. A philanthropy works with many different partners. So we have had exposure to a wide variety of implementation strategies across the sectors that we fund. So this gives us a wide perspective on what is possible and the ability to test program designs. Capacity building, another very important one. Being able to provide support to grassroots organization to build their capacity is I feel is an extremely important thing that philanthropy can do. And then collaboration is another important thing. We can bring people together. It's sometimes it is just about the funding. So with funding, we can create networks and bring people together to talk about many of these important issues. And last but not least is another one about, is about funding, but it can be motivation sometimes. We've had success where if we're able to work with an organization and tell them, for example, providing matching funds, that other funders might come to the table if they think that the money that they give in will have this kind of added value when providing matching funds. So that's another important thing that we can do through philanthropy. I'm sure there are many others, but given a short time, that's my summary of how philanthropy can assist. And then next, I was kind of asked to give a little bit about partnerships and, considering that we are a US-based organization, but we work solely in India, how partnerships can be facilitated, especially focusing on technology and innovation. So there are many issues that the US and India can develop partnerships around as it relates to technology innovation. We don't, I just told you what we focus on. So it's not as if we focus across the board on tech and innovation, but technology and innovation in program design has allowed for new approaches to alleviating old problems. So for us, as I mentioned earlier, we focus on education. So we've been able to bring technology into the classroom to create more stimulating learning environment, and by bringing partners together that create the curriculums that integrate audiovisual components into teachers' lessons. Specifically, in STEM education, approaches that allow for hands-on experimentation can lead to more children being interested in becoming tech professionals or stimulate the thought process for our future entrepreneurs. Now, in health, which is what, the majority of what we're talking about today, many people have already brought this up, but, many have seen the birth and expansion of telemedicine that has provided access to health services, both physical and mental health services, to those who had limited or no access previously. Additionally, also already mentioned, electronic medical records have allowed for more consistent care and easier processes when patient referrals might be necessary. As with education, technology in the health sector can facilitate the transfer of important information that equates to a better quality of life or even to extending a person's life. So our partnership with Wheels Global fits very well into this category. Through the Addressing Newborn Nutritional Health in MP program, WRIST and Wheels Global has set out to increase the number of mothers in India sticking to breastfeeding by promoting a tech-savvy approach called spoken tutorials. This illustrates proper methods and educates on the importance of this mother-to-child practice. And I do briefly, I know, I don't know what my time is right now, but I do want to just take a real quick minute to illustrate through a story. I just got back from India, and we had the opportunity to work with a partner who's working on dialysis treatments at government hospitals. And as we were working with this organization, something that was brought up was the fact that we went to a pediatric care ward, and there were a couple really like infants already on dialysis. And as you can imagine, it's quite shocking to see that. And when talking to the doctors there, some of them has said that the reason that the infant had to go on dialysis because their mothers had been using formula with through a tainted water source. So it just brings another, preventive, side of things to the project that Wheels Global is implementing, and just really elevates and shows quite practically the importance of this project. Some other obvious partnerships, although WRIST is not necessarily involved in the health sector, is the pharmaceutical industry. Drug development and biotech R&D can accelerate innovation and bring new treatments to the forefront. And lastly, just one more minute, is in the environment, which, as I mentioned earlier, is a focus of ours. Partnerships on new technologies that focus on sustainable living will help both countries address climate change. An obvious subtopic under this heading is energy transition. So we must delve deeper into current renewable energy sources to ensure that they are truly environmentally friendly and not just a Band-Aid that will reveal a festering wound for the next generation. Innovation and technology will be imperative in the fight to combat climate change, for sure. And, as I mentioned earlier, just a few others that we don't necessarily focus on, but just to give, some food for thought, is innovation and technology and telecommunications, e-commerce, and cybersecurity. So once again, thank you for giving me the opportunity to talk, and thanks to Wheels Global for your programming and your dedication on the ground.
Thank you very much, Paul. Thank you for enlightening us with your amazing work at Wrist Foundation and your dedication and love for underserved communities in the world. We are grateful to you for putting trust in us. And you already mentioned so much about technology. Well, Wheels is all about technology. Its guiding principle is technology leverage solution for rural communities. So thank you again, and we are grateful for the grant, and we hope we will have more opportunities to work with you and receive the support. Now, let's hear about Wheels' mental health program. It is my pleasure to introduce Dr. Bindu Kumar Kansapara, who is Wheels' board member and the vice chairman of the Health Council, and he leads the mental health program. He is retired cardiologist, but he's a great philanthropist, entrepreneur, educator, and healthcare political activist. Bindu is my nephew and was my cardiology practice partner for 30 years. He was assistant professor of clinical medicine at Drexel University. He's board certified in internal medicine, cardiology, echocardiography, nuclear cardiology, currently member of AMA delegate, Pennsylvania Medical Society trustee. He received his MBBS degree from Topiwala Medical College in Mumbai and postgraduate training in invasive and non-invasive cardiology from Medical College of Pennsylvania, which is now Drexel University Medical School. Bindu is truly passionate about mental health and integrated health. And I'll let him give idea about what we are doing at Wheels in mental health arena. Bindu, take it.
Thank you, Dr. Shah, and thank you, everyone. It's my privilege to speak about mental health initiative led under Dr. Shah's guidance. First of all, as you know, mental health epidemic is engulfing the entire world. 1 out of 4 people are affected with mental health. Especially rural healthcare is very important for our mission, and rural population in India is not aware of mental health issue, acceptance is a major issue, and affordability is a major issue. So our Wheels leadership has assembled world-class experts to explore the innovative tools for assessment and for education, so mental health awareness can be propagated through our digital platform to rural India. We have selected 3 innovative solutions for this, so every age group can benefit. Number 1, we have selected Yoga Immortal, led by Dr. Ishan Sivanan, to address the mental health issue for senior citizens and adults population, non-pharmaceutical intervention. Number 2, for middle school and high school students, we have partnered with organization led by Chinu Agarwal, which is called Filling Mind, and they have some amazing data. Third is digitally enabled solution led by our speaker today, amazing young talented person who has founded Peak Mind, is Neeraj today. So these 3 people are our future, and our goal is to reach every village in India through digital platforms, so we can reach final mile at the time of service, at point of service, and that is our mission. And my humble salute to all my leading partners, experts, and Dr. Shah for giving us opportunity to just give us our thoughts. I want to request everyone to, as Ratan said, assist us with the talent, time, and treasury. Appreciate your help for this noble cause. Thank you. And at this time, I have a privilege to introduce this talented, young, dynamic leader, Neeraj Kumar, whom I just want to say, Neeraj is amazing spiritual leader. He's an IIT Delhi alumni, innovator. His mission is to say no student should be impacted because of mental health. so they are not able to unlock their true potential. He's big support of holistic medicine, mental health, and he has time-tested model which they have provided 150,000 plus students. And his mission is to help our cause. He's helping us with mental health research as well as integrating his portal with our portal. So without further ado, it's my honor to introduce this dynamic, energetic, prolific speaker, Neeraj Kumar. Neeraj, floor is all yours.
Yeah,
And go ahead.
thank you, Dr. Bindu. Yeah, can I just get the can you please remove this screen sharing? I'll share my screen.
Yeah. And Neeraj, can I ask you a question, which
Please.
I'm very impressed meeting you and seeing your portal. It's amazing that what you have touched the lives of these aspiring high academic students from 8th grade to IIT. I want to know how in this pressure cooker environment, our young students are coping up with this mental stress, insomnia, anxiety, depression, and how you have developed this technology driven solution, and what are your results, and what are your goals to integrate with us as a wheels. Go ahead, and floor is yours. Thank you.
Sure. Yeah, sure. Thank you, Dr. Bindu, and everyone. You already highlighted the importance of mental health. And specifically, today I will be covering about student, and we spoke about youth. I think our youth are our future. All the panelists have highlighted the importance of mental health. So India, if you look at on my screen, India has the largest adolescent populations, 253 million. And every student in India at some point of time goes through some competitive exam. But today I will specifically highlight the two which are most spoken, which is the engineering and medical entrance. So in this journey, from a mental health perspective, if you look at that, the students are always on the edge. Their mind always have the emotions and pressures, fear of failure, restlessness, emptiness, negativity, the fatigue, like I think we spoke about the nutrition. So all these things big time impact them throughout this journey. If we look at what happens exactly on the reality behind the scene. So since we are talking about two major competitive exams, which is engineering and medical, so this year, more than 3.7 million students appeared for this exam. And what happens if you look at the stats here, these are very, very high stake exam. Only less than 8% will qualify, which is less than 200K. So the big question is, these 92% plus students, are they failure, or the role of this competitive exam journey where they're going to spend 2 or 3 years at least. And it is not just the student goes through this journey, their entire family pins their hope on this student. And they invest their lifetime savings, some even take major loans and send their daughter or their sons for for the preparation of these exams. So the big question for us is that how we make these competitive exam journey psychological safe, and these students have psychological powers to unleash their true potential. So behind the scene, the major critical concerns in this competitive journey is, I think it's a tip of the iceberg. Everyone focuses on the academic empowerment. We have edtechs born, we have resources, digital content. But if you look at the underlying, this is where the entire mental preparation, the skills they need, the support they need, the education they need, the care system they need in place throughout this journey. And not only at the last leg, when someone has reached. So I think the way we look at the competitive exam journey, they are the marathons. And then the marathons of the sprints, there's this marathon of sprints for these students because they continuously appear for exams. So the research says more than 40% students underperform due to lack of their mental preparation. At least 20% have shown suicidal tendencies, and that 45% plus students live severely anxious. And at least 25% plus students have the moderate to severe depression. Now, if you look at these stats, so these are majorly concerning stats, because what happens, they are affecting their life today and also in future. So we spoke 92% plus students will go and do something else in their life. So this anxiety is the major concern that Peak Mind suicide prevention is the major concern that Peak Mind is addressing. I think this is the platform for IITians, Wheels. The suicides in IIT have been the major concern in the recent year and the last year. The India newspaper have had this major headlines. The government are in the action. New education policies, big time talking about how do we provide mental health and well-being support to every student. They're bringing new suicide prevention drafts in place. But I think the big question is still is that how we can take it to the every student, and that is where the technology, the research is going to play a big role. How do we leverage the power of the ecosystem, partnerships who are already working on the other areas can collaborate together and take it to the every student. So little brief about the Peak Minds journey is that in last 3+ years, we have helped more than 1.5 lakh students put together. We have directly saved 87 lives ourselves, and with our partners, more than 5,000 students whom we could identify preventively and resolve those issues. So our mantra is that every student on this journey need to develop their personal mantra for happiness. And so for that, the innovation that Peak Mind has done is, one is the power of AI and the research. The mental health companion, very contextualized for the students, which talks about their issues, their aspirations. So we are talking about availability, affordability, accessibility, safety. So it's a 24/7 companion and is personalized for the students. So the team is again IITs and mental health experts on the board. So the platform takes care of a very comprehensive solution, which is from education, diagnosis, instant help, digital self-care, habit development, and expert help, which is the last mile. You know, the mental health experts are on the platform. So so the one major thing that we have done, we have spent last few years in coming up with a suicide prevention. I think as a society, it's a huge responsibility on us that every student matters and no student should lose their life because of any competition, any stress. And for that, I think to complement the traditional methods, which are mostly in form of making counseling available and helpline available, we believe that how every student can be part of this platform, and using our AI technology, we can generate preventive alerts so that they can be helped on time. So these are certain journeys on the platform. We engage students throughout their journey at every step, and they share a lot of insights with us, how they engage with the platform through their moods, emotional regulations, our recharge sessions. How do they even trust the platform and proactively share that if they have any suicidal ideations, thoughts, and all. So the platform is purely data driven. We empower and provides the right insights to the users, to the institutions, decision makers, that how the right decisions can be taken. So their impact on holistic development, all the areas of students, from sleep to their performance, confidence, anxiety, focus, time management. And students find this platform, the comprehensive platform, very helpful. There are a number of testimonials and data we have. So yeah, I think with that, what we're looking for in terms of collaboration with Wheel is in this role is that how do we take this solution to the larger part of our rural students, and also the privileged one, the IITs, do more exhaustive research and help all these students. Yeah, thank you, Dr. Bindu. Yeah, that's it.
Honor to be with you. Thank you for being part of
Thank
us.
you. Right. Thank you, Bindu, and for leading, and thank you, Neeraj Kumar, for enlightening us with amazing work that you are doing. And Bindu, thank you for leading the mental health initiative, a huge problem, not just in India, all over the world. And your passionate approach helps Wheels to make some great impact. Now, let's talk about Wheels menstrual health program. Wheels first started working with partner NOBA, GSR, which stands for Netterhut Old Boys Association built by alumni from IIT BHU and IIT Bombay to provide affordable and accessible quality pads through the self-service dispensers at a very low price of ₹2 per pad. NOBA has scaled that program to more than 1,000 communities in Bihar and Jharkhand. Now, Wills is supporting next innovation, Saukhyam, to provide environmentally friendly, biodegradable, and reusable pad that also has potential to eliminate countries' import bills of billions. With that, I would like to introduce our next guest, Anju Bist. Anju Bist is the founder and CEO of Saukhyam Reusable Pad. She works with rural women groups who are both producers and consumers of the product. The pads are made in rural India and sold not just in India, but also exported to US, UK, Germany, Spain, Netherlands, Kuwait, and Nepal, all over the world. And Miss Bist is referred to as Pad Woman. All of you remember that movie Padman by Akshay Kumar? Here we have our Pad Woman. Saukhyam's team works to provide high quality, reusable menstrual pads to women and girls everywhere. They are working hard to make reusable mainstream and disposable as the old-fashioned idea that really it was. Anjuji, please share with our audience what inspired you to build Saukhyam and how it is uniquely addressing the country's critical needs for menstrual health solutions that are good for economy, environment, and women, and especially for young schoolgirls in rural areas. Anjuji, please take it.
Thank you, Dr. Shah. Thank you, JVG, for sharing the screen. We can go to the next slide. So, you know, half of the world's population menstruates, and for nearly half of our lifetimes. Menstrual health is something that is at the root of so many health and education problems that we see in rural India. Girls drop out of schools. It happens even today at the onset of puberty. Health problems such as cervical cancer, other reproductive health issues. So if we fix this one problem, menstrual health, it leads to much better health and education outcomes. This is what we have seen in our years of working. So some other points that we quickly want to share. You know, all of us know that paper is made by cutting trees, but the absorbent material in most disposable sanitary napkins that are made and sold globally, that is also made in much the same way as paper is made and by cutting trees. But because periods and menstruation is a taboo topic, it doesn't get discussed much. So this is not common knowledge. Our sanitary napkins are also a driver for climate change. And in fact, cellulose fiber is not produced in India, it is imported. India annually spends some US dollars $235 billion for importing cellulose fiber. So trees are being cut down in some part of the world to make this absorbent material for sanitary napkins. Early on in our research journey, it was a funded project by the Government of India, the Department of Science and Technology. We stumbled upon banana fiber, which is a type of cellulose fiber, but it comes from agro waste. The banana tree is very, very unique in that it fruits only once. So once it's given fruit, it's cut down. And you're not cutting a tree to get the fiber, you are getting the fiber from a tree that has already lived its useful life. Now, this is a project of the Mata Amritanandamayi Mutt. Perhaps some of you know of Amma, you have heard of Amma. She is revered all over the world as a spiritual and humanitarian leader. And Amma's guidance to us when we were developing Saukhyam was, so initially we thought of making disposable pads with banana fiber, and the research was proceeding in that direction. Amma's words were, even though banana fiber comes from waste, it is still far too precious to be used once and thrown away. And so we set on this journey to make reusable pads from banana fiber. We were the first team in the world to do it. Today, India has ISO standards for reusable pads. The reusable pads industry in India is very healthy, thriving. There are 20-25 players in this industry, which is a really good development. Most use cloth as the absorbent. We are the only ones, to the best of our knowledge, that use banana fiber. We have a variant that uses cloth also. So to come back to disposable sanitary napkins, these huge numbers, because the pads are non-biodegradable. Most varieties are. So, we like to give this analogy of the mobile revolution that enabled rural India to leapfrog in a way. They didn't have to wait for phone connections or, through landline phones. So now reusable products are available. They are very popular in rural India. Why introduce disposable? Let them amongst educated women, reusable products, not just reusable pads, but the whole, there's menstrual cups, there's period panties, and so on. Reusable pads are probably the ones that are the most effective for young girls. And also reusable products are not either or. People may be using a period panty and a reusable pad, a menstrual cup and a reusable pad. So a lot of educated women are going on for these solutions today. Why not introduce them to rural India and not have them go down the path of disposables? So we started our work. JVG, we can go to the next slide. Quickly, a couple more points about disposable sanitary napkins. So now there is good research, although definitely there needs to be more awareness about dioxins, furans, and so on present on disposable sanitary napkins. A big health threat. 1 in 4 girls in India is affected by PCOS. We see this phenomenon more in urban areas. And somewhere it can be linked to the use of these kinds of sanitary napkins that have, we can go to the next slide. And the next. So there was, for the first time ever, there was a study done with these 10 brands of disposable sanitary napkins in India, and it cost a furor. This was in November 2021 on both social media and the popular press and media. Phthalates and VOCs were found in all 10 brands tested. Unfortunately, the Bureau of Indian Standards has not, fortunately, they are in talks to come up with standards that would, eliminate the presence of these, but unfortunately, those standards have not yet come out. They're just in talks stage. So we can go to the next slide. JVG, yeah. So reusable pads, in case we are wondering, they last up to 3 years. They can be washed and dried. A lot of our work is doing awareness workshops, raising awareness of the fact that menstrual blood is not, there's nothing called impure and pure menstrual blood. Menstrual blood is just like any other blood in our body. If anything, it has micronutrients and so on. So we talked about breast milk earlier. Before we were even born, when we were, a tiny fetus in the first stage of our existence, our mother's menstrual blood is what nourished us. Touching our own, blood-soaked pads, washing them is not at all gross. And so a lot of work to build this kind of awareness, change the narrative, and that's pretty much what we've done during the last 7 years of our existence. SOCIM has been fortunate to be awarded, we can go to the next slide, at several different forums. Niti Aayog gave us the Women Transforming Award, and Wheels Global also recognized this innovation. So we are a husband-wife team working on SOCIM. My husband studied at IIT Delhi. He graduated from there. It's taken us 7 years to reach 500,000 pads. with Wheels Global support, we are looking forward to the pathway to the next 500,000, which should be achieved in a much shorter span of time. We can go to the next slide. So rural women is this is also an employment generation for them. The banana fiber is processed using machines, and then the last step is the stitching, which employs a lot of rural women as well. So this was a brief overview of our initiative. We are looking forward. We've begun work on initiative in Varanasi. We are working currently with 3 state governments. We heard a lot about MP, Madhya Pradesh state government. So we have an MOU with the Madhya Pradesh State Rural Livelihood Mission. In Karnataka, we are working with the Department of Education. And in Odisha, we have just started work with the Department of SC/ST. In these are pilots to get reusable pads to, I would say, thousands, if not hundreds of thousands of women from rural and tribal backgrounds. And we have just started, we are in discussion with Wheels to begin a project in Varanasi, in UP. We're greatly looking forward to that.
Well, thank you very much, Anjuji, for enlightening us with an amazing solution to a problem which will have immense implication in women's health. Now, let me thank all our speakers for your excellent presentation and addressing your initiatives and your help in Wheels Global. I have curated few questions. There is not much time, and couple of them. One of them is asking about our not-for-profit 513 status and number, which is on our website, wheelsglobal.org, and you'll go under donate, and you'll have all the information you need. All the slides, requested slides and presentation, and our entire webinar presentation will be online on our website, wheelsglobal.org. So you can download slides, you can listen to the webinar or any other points that you have. There are many comments and feedback that came, which was to help us, and enjoyed this particular feedback that this was very useful. And let me just tell you, this was only a very small portion of what Wheels is doing. There are many other areas where we are working on with many other organizations to bring healthcare, particularly to the rural community of India. I also would like to request that all your feedback, and so many of you made comments about health, please, we are looking forward to it. Send your, go to our website. You can direct your questions, answer, call any one of us, and we are happy to bring you in. We are looking for your generous support in time, talent, and treasure. Anyone or all 3 are welcome. And as you know, the
Dr. Raj, maybe we can take maybe
we'll stop. Wheels can only roll with funds. Keep coming. We are looking for help. Now I'll ask our president to give a closing remark. Thank you, Ratan.
So we have about 4 minutes. Maybe we can take just 2 questions. There was a question about mental health in terms of the demand and supply is so different in terms of even in the US, we have more than 50% high school kids taking anxiety medication. And in a country of the size of 1.4 billion, maybe Neeraj can comment for a brief 1 minute how technology can help bridge that massive gap between demand and supply.
Right, Ratanji. I think the biggest help is using technology is preventive. Where like I was talking about the anxiety, the kids live through the anxiety. If we can empower them with a digital solution through the right education, early diagnosis and self-care, we can prevent a majority of the number, more than 90% of the kids can be saved from reaching the stage of acute anxiety. So I think that is where we see a majority of the solution.
Thank you.
Ratan,
Thanks,
if I may
Neeraj.
add, there is a big role of prevention by non-integrative approach, because medicines are important, but at the same time, they should not be used inadvertently, which is being used in many countries, including USA. And I think there are a lot of side effects. So we need to have this parental teaching IKS solution, which Ishan Sivanand has introduced, which is one of our variable. I think there are a lot of ways we can address. Medicine is not the only answer. Precipitating factor has to be addressed. And as Neeraj mentioned, his approach is integrative healthcare solution. Thank you.
Thank you, Thank you, Neeraj. And the last comment briefly again to Anju, there was a question about in the menstrual health program you are driving, it looks like education both on the environmental side as well as the awareness of menstrual health issues itself in terms of taboos. How are you tackling that again, the need being so pervasive across 29 states, large population, rural population, remote areas? How are you tackling that?
Right. I want to speak about one of our partners who actually introduced us to Wheels Global. This is the IIT Delhi coordinated excellent program for higher education institutions in India, Unnat Bharat Abhiyan. So we start with the college girls in the colleges. We do awareness workshops and so on. We have done it in 7-8 states of India in just the past 1 year alone. And then we take the help of these girls to reach out to the women and the girls in the rural areas that they have adopted. While the college girls, resonate more with the environmental issues, it is their first-hand experience with using the pads and finding that they offer a much more wholesome period experience. That is what speaks to the rural population. So this is one thing that is working for us. Of course, it's not easy to try and change the narrative. Wheels has found value in this, and we feel greatly strengthened and some of the amazing innovations that we heard about today using CSCs and so on. So hopefully in the future, we can partner with some of those also to reach out to more folks in rural India.
I have a couple of questions that came through, and one is for Priyaji to say how a villager can approach and get a CSC started in their village, and what is required. And after you question to Paul, how one organization goes about receiving help and grant from RIS Foundation, and is RIS Foundation looking at focus on senior citizen? I know we have only a minute left. Kindly answer those two questions and then we'll bring it to end.
Dr. Shah, so the CSCs are looking to expand very rapidly. And so any entrepreneur that is able to, any entrepreneur across the country that actually wants to sign up on the CSC, if they can just reach out to us and I'll connect them to the CSC folks. We're also providing access to additional financial support, training, and mentorship so that in addition to them signing up with the CSC, they have a lot more support, right? A lot more holistic support so that not only can they sign up, but they can succeed in their journey as being a VLE.
Thank you.
Thank you.
Paul?
Sure. So, yeah,
go ahead.
Organizations can apply directly to us through, usually we advertise on our website when we have an opened opportunity for grants. But a lot of times we meet organizations through a bunch of different ways, and we end up giving them a grant based on a relationship that we've formed and understanding their program. But there are times where we do kind of have an open application process. And as far as the other question, we don't necessarily focus on the elderly per se, but we have funded programs that that deal with health and mental wellness at the community level, which would include the elderly population also, assisting with depression and them finding services that are available at a lot of times no cost.
Thank you.
Thank you. And thank you to our audience. And last, thank you so much for listening and providing us feedback and your useful suggestion. Thank you, speakers. Thank you for taking this time. We greatly appreciate. And now the last word from our president, Ratan Agarwal. Ratanji.
Thank you. Thanks, everybody. And it is such a pleasure to see nearly 120 people and listening about variety of innovations, and not just the leverage of the technology, but how each of these innovators are coming up with ways to scale these solutions across such a large country, 1.4 billion, very challenging remote and rural areas, and finding ways to take their innovation across that such a large population. I think you heard from Anju about a wonderful program called Unnat Bharat Abhiyan, which is penetrating the entire country through its coordination across 3,600 higher education and research institutions. And Wheels is partnering with that program to create seamless pathways between R&D development activity across our institutions, be taken to thousands of NGO network, so that way the development doesn't sit in the four academic walls, but rather can get to the rural beneficiaries. And you will be seeing a very good article on that in the latest edition of New India Abroad, as well as a blog on our website. Lastly, we will be doing another webinar. This is today's webinar was our second one, covering each of the 6 Wheels domains. So look forward to seeing you again on 31st August for webinar on the livelihood innovations. And you will be again seeing number of innovations covering livelihood programs, use of technology, as well as innovations, whether it is vocational schools, whether it is tribal girls, whether it is rural youth. So look forward to seeing you on 31st. Again, thank you, everybody, all our speakers and number of Wheels leaders who joined, volunteers who made the program happen. And you will be able to see recording of this, as well as some of the answers which we were not able to cover today. Once again, thanks everybody's time, and we look forward to your support and contributions. Wheels depend upon you. We look forward to your generous donations as well as time and talent, so that we can accelerate our journey to the impacting 20% of India's rural population. With that, I would like to officially close with my sincere thanks to all the speakers for making time today. Thank you.
Thank you all. Our webinar is closed. Thank you.